It's funny. I was just talking to a patient about that today. Um, Unexplained infertility means we don't have a clear-cut diagnosis why the couple isn't getting pregnant. And actually, unexplained infertility accounts for 50% of infertility. It's just amazing. 50% of infertile women. It's simply because we don't know. And so the Japanese have done some interesting research on this, and I'll share that with you. Um, Women who have ovulated, they will just put in a ultrasound probe and aspirate that. We call it a corpus luteum, where they ovulated and the egg should have been picked up by the fallopian tube. And very often they find an egg stuck in that corpus luteum, which means that very often you think you've ovulated, but ovulation is an explosive process where the follicle just bursts through the epithelial covering of the ovary. And it's a violent thing, actually, if you think about it microscopically, and it often fails. And so you think you ovulated, but the egg really never got out. It never got picked up by the fallopian tube, or never fertilized, therefore. And there's no clinical test we have for figuring that out very well. But we know from the Japanese research that that happens a lot. So unexplained infertility has to have an explanation, but with our routine clinical tests, we're really not able to do it. So half of these patients really, we may imagine it's a low sperm count, but even very low sperm counts get the woman pregnant. We may imagine that it's endometriosis, but most endometriosis isn't going to cause infertility. So half of the patients we see really have unexplained infertility. What's the treatment for that? IVF. It used to seem strange. If you don't get pregnant naturally, why is IVF going to help you get pregnant if we haven't determined the cause of the infertility? Well, the cause we know, at least in many cases, is the egg is not being picked up from the surface of the ovary and not getting into the fallopian tube. And so there's no chance of fertilization or embryos to migrate back down into the uterus. So sometimes unexplained infertility may just be because we weren't that smart about it. But other times, I think it's things that we really can't evaluate clinically. But if we do IVF, we bypass everything that can go wrong, and we get a high pregnancy rate despite having no truly reliable diagnosis of the cause of the infertility. So that's unexplained infertility, and you just have to go to IVF before your eggs get too old.